Hello, everyone, and thank you for joining us for Pregnant During a Pandemic, Resources and Support for Before, During, and After Pregnancy. My name is Victoria Bruick, and I am Pandemic Parenting's digital content producer. And we're so excited to have you all here. And for many of you, this might be your first time joining us, and we're so excited to have you with us. This webinar is part of a bi-weekly Pandemic Parenting Exchange series. And in each of these webinars, our panelists offer science-based knowledge, experience, and resources to help you and your family cope during the pandemic. To stay up to date on our latest webinars and other things that we're working on, our social media, you can follow us on social media and subscribe to our email list. We also, if you are on Twitter, we welcome you to tweet along tonight, hashtag pandemic parenting, and share what's standing out to you, which tips and ideas you're going to be taking with you after this webinar. Lastly, I'll be in the background sharing links to different things and resources mentioned. And if you don't have a chance to catch all of those links, or you want to come back and listen to certain parts again, we'll be releasing a recording of this webinar. If you're on our email list, you'll be the first to know about it and follow us on social media, so you'll be able to see when that's available as well. That will probably be in the next few days. So with that, I want to introduce our two co-founders of Pandemic Parenting. Dr. Amanda Zelechoski is a clinical and forensic psychologist and an associate professor of psychology at Valparaiso University. Dr. Lindsay Malloy is a developmental and forensic psychologist and an associate professor at Ontario Tech University. You can read more about them and their backgrounds on our website. With that, I'll turn it over to you, Lindsay.
Thank you, Victoria. And thank you everyone for being here tonight. We're really excited about this topic. It's a very personal one for me, and I'll probably share a little bit about why later. But I want to introduce our moderator for tonight. One of our goals here has always been to highlight emerging scholars in the field. And so we always ask an emerging scholar to be one of our moderators. So tonight that is Alyssa Morris. Alyssa is a PhD student in clinical psychology at the University of Southern California. And her focus is on perinatal mental health and child development. She recently launched the Coronavirus Health, Isolation, and Resilience During Pregnancy, or the CHIRP study, alongside Dr. Darby Saxbe, and that's to assess the impacts of COVID-19, the COVID-19 pandemic on the perinatal experience. So welcome, Alyssa, and I will turn it over to you.
Thanks so much, Lindsay. So we're going to start off today with a discussion with our panelists and some guest experts in the field, and then we'll follow it up with a Q&A discussion at the end, so feel free to use that Q&A chat box throughout the discussion, and I will keep an eye on it and offer some of those questions to the panelists towards the end. So first I'd like to introduce Dr. Cindy Lee Dennis. She's a professor at the University of Toronto and the Women's Health Research Chair at St. Michael's Hospital in Toronto. So welcome, Cindy Lee. Next, I'd like to introduce Dr. Tiffany Green. She's an assistant professor of population health sciences and obstetrics and gynecology at the University of Wisconsin-Madison. And then finally, I'd like to introduce my mentor, Dr. Darby Saxbe. She's an associate professor of psychology at the University of Southern California. And I just want to give a moment for each of you to highlight where your expertise is at and where you're coming from. So we'll start off with Cindy Lee. Do you mind just giving a quick overview of what you do?
Yeah, so I'm a professor at the University of Toronto, and for the past almost 25 years, I've been conducting research looking at maternal health. I've expanded my program of research to include fathers now because fathers do matter and impact child developmental trajectories. I focus a lot of work on breastfeeding and develop the breastfeeding sufficiency scale and such. And a huge component of my program of research is on perinatal mental health. Thank you.
Awesome, thank you. Tiffany, do you mind introducing yourself and what your research and focus is in?
Okay, mic is on. All right, hi, I'm Tiffany Green. I am an assistant professor of obstetrics and gynecology and population health sciences at the University of Wisconsin-Madison. By training, I'm an economist and a population health scientist, and my work really focuses on the causes and consequences of racial disparities in reproductive health primarily, although I do look at other populations, including immigrant populations in the United States as well. I have a lot of different projects going on, but what I'm excited about now is work I'm doing trying to look at the intersections between discrimination and disparate birth outcomes among Black and white and other women in the US.
Great, thank you so much. Darby, do you mind sharing a little bit about your...
Yeah, I'm so happy to be here with such a great panel. So I'm a psychology professor at the University of Southern California. My lab has been following first-time expectant parents over the transition to parenthood. So we recruit couples in pregnancy and we follow them across the first year postpartum. And as Lindsay mentioned, working with Alyssa, we've launched a new study to look at how the pandemic has affected the transition to parenthood specifically. So I'm excited to share some of what we've been finding from that work as well.
Great, thank you. So we'll go ahead and start with a more broad question. Pandemic or no pandemic, what do we know about what helps parents in the weeks and months after the arrival of a new baby? If anyone wants to jump in with an answer to that one, welcome it.
I'm happy to jump in on just this idea that the transition to parenthood really is a transformative time. And so if we think about all the different layers of changes to our hormones, changes to the brain, changes to our sleep schedules, changes to our relationship and to our identity. So it's really this nexus of really sort of interconnected changes. And I think it's a time of kind of heightened social needs, more need for support and for connection. And that's one reason I think that the pandemic has been so challenging for so many expectant parents.
Definitely. Cindy Lee, this might be a good question for you. What do we know about what contributes to mentally healthy pregnancies? And are these the same sort of factors that support parents in the postpartum period?
Yeah, so perinatal mental health has been getting lots of attention recently. And we know that there's some pretty strong risk factors that place women at risk for having either depression or anxiety in their pregnancy. I think, there's very good evidence to suggest that if you've had a past psychiatric history, so depression in adolescence, before you became pregnant, independently of childbirth, that's a big risk factor. So just knowing that you have a predisposition to having depression or high levels of anxiety. I also think in pregnancy, it's about, we have had, a brief conversation here about hormones, but also the social context that you live in and your partner. And I really think that if we move from a treatment model to one of prevention, then I think that we should be focusing on strategies for the whole family when it comes to perinatal mental health and not just focusing on the mother. So what type of relationship does the mother have with her partner or significant other or family members? I think that can say a lot about whether this woman is at risk for having mood disorders during her pregnancy. And that will carry on into the postpartum period unless it's treated. We know that a lot of mental health goes untreated for many reasons. First of all, we're not screening for it. There's a movement towards screening, but also, women feeling ashamed or feeling that there's stigma associated to it. And because we're talking about it in these types of form, we're trying to say that, mental health issues can happen with anyone and that it's okay, that there's great treatment available, and that doesn't mean that there's going to be, real long-term negative effects on children. So that I think that it's really important to highlight that, it's okay to disclose this and to seek help when you get it. So to summarize, past history is a real big risk factor, and the social context that you live in, the type of relationship you have with your partner, the social environment you might have with family and friends. I think that those are two really critical things. And if you're really anxious, we know that anxiety often starts before a depressive episode. So if you're highly anxious, then I think that that's something that needs to be discussed as well with a healthcare provider so that it doesn't deteriorate into potential depression.
Thank you.
I think that I just wanted to jump in real quick and say that this might sound kind of foolish, but even knowing what I know, and I'm not an expert in this area, but even in psychology, didn't really fully understand that postpartum anxiety was like a real thing. You know, I'd heard so much about postpartum depression, but to find myself in a position where really anxiety was what I was feeling after both my kids were born. So that was a real wake-up call. And I think I've been trying to highlight that with new moms that I know, like, this may not manifest the way that you think it will. So I just wanted to jump in on that too.
I totally agree with you. I think the anxiety is, we have a treatment hierarchy, is what we call it, where we first target the depression, and we always focus on depression. And now we're beginning to realize that anxiety is very prevalent. I've just published a meta-analysis of over 103 studies conducted around the world to say that almost 1 in 4 women have high anxiety in one of their trimesters during pregnancy. So it's highly prevalent. And that we know that in the first 4 weeks, almost 1 in 5 women have very high levels of anxiety. And it decreases after that first month. So it goes into what Darby was talking about, the transition into parenting and, you know, all the different changes that occur in someone's life after the birth of a baby. But we still know that even after you transition into parenthood, 15% of families will continue to have high levels of anxiety across that whole first year postpartum. So it doesn't just go away. There's high anxiety. And we need to be talking about this anxiety, because sometimes it can lead to the depression that I was talking about. And then you have these parents with comorbidity. And these are women who have both high levels of depression and anxiety. And those are the families that are really vulnerable to having chronic recurring mental health issues in the families.
Yeah, thank you.
Tiffany, I think this would be a good question for you, because I know your research revolves around some of this. But as you know, Black women experience significantly worse maternal mental health outcomes in the US compared to white women. Can we talk about how that disproportionately impacts, how the pandemic is disproportionately impacting that as well, and how that might further exacerbate these disparities?
So so a lot of my work, has been around public education around the determinants of COVID, and sort of moving away from this biological model that people seem to think that race is some biological or genetic COVID determinant, rather than a marker for a bunch of systemic social risks. But anyway, what I've seen is that just from reading the extant literature is that you see exacerbation of existing disparities. Like there's, systemic inequality is breathtakingly unoriginal. So what we see is that Black women generally don't have as much support as women from other groups. We see this in national surveys and local surveys. And it's getting worse. So at the beginning of the pandemic, a lot of hospitals didn't know what to do in terms of infection control. And so there was a lot of confusion, a lot of telling women or birthing people that they couldn't have support or doula support. So for some women, doula support is a very important way to have that extra set of hands during a delivery, and that was not allowed. There was a young woman, I think her name was Amber Rose Isaac, who died in a New York hospital, and her partner and her mother were not allowed in when she was getting an emergency C-section. So you keep hearing these anecdotal stories, and I think what they all, sum up to is that Black women don't have the support relative to other women, which of course leads to stress, and which of course leads to adverse mental health outcomes. And it's exacerbated by a pandemic where people are losing their jobs, where people don't know where the next meal is coming from. There's probably almost a threefold difference between whites and Blacks in the US in terms of knowing someone who's died from COVID. So all of those things, I think really we are not going to understand the full impact of them for years to come. And unfortunately, I don't think that we will run out of things to research and talk about when it comes to reproductive health and COVID for a very long time.
Thank you so much. So from your perspective and knowledge of the current literature, what are new and expecting parents worried about right now? What are their major concerns? I guess, Tiffany, if you want to just start us off with that, and then maybe we can loop back to Darby and Cindy Lee.
So I'll put back on my economist hat rather than my population health science hat for a minute. I think that people generally are worried about where their income is coming from. Congress has not passed the stimulus, as you probably can see from the news. Congress has been very busy confirming a Supreme Court justice right before the election, but they have not passed a stimulus bill. Mm-hmm. So there are a lot of people who do not have income coming in. There are evictions that are pending, and we know that is probably going to be a disaster because we're in the middle of a pandemic and you'll have a bunch of people that may be put out of their homes. So I honestly think that a lot of what people are worried about now are those basic economic needs. And when those needs aren't met, those can have such huge adverse mental health outcomes. So that's my best guess at what people are really worried about. I think right now we just don't know a whole lot about pregnancy and COVID. You know, we're collecting data. A lot of the data are convenience samples. So I think that over time, I'd like to be able to study some of this in more representative data. But again, that might take some time.
Definitely. Cindy, Lee, or Darby, do you have any thoughts to add to this?
Well, I think Darby does because she's got that COVID study ongoing. So I'm sure that you're assessing that. We've just finished one at the hospital. We had, it was called Pregnancy During COVID or something. We had a whole bunch of over 7,000 women following. And the top concerns that we found when we sent out a survey to the 7,000 women is that they were concerned about themselves getting infected, passing it on to the fetus. That was a real significant concern. Or the child, you know, if they had other children, having them infecting other children was a big concern. Their social environment, not being able to meet with family and friends who are traditionally sources of support after the birth of a child. So being physically isolated. And as much as we like to say that, you know, these Zoom meetings and everything and Skype are lovely, it's not the same as having an extra pair of hands at home. And so that's why, you know, when we think about this in the postpartum period, we need to think about what we can do to boost our mood during that time. Just simple strategies, because we do have a pandemic going on, and you know, you might not have the supportive resources that you typically may have had previously with previous births or just outside of this pandemic scope. So I think that, you know, encouraging family members to get outside, to go for walks. When I say family members, that's the social bubble that we're talking about. I don't know if you do social bubbling in the United States, but here in Canada, we definitely are doing social bubbles. And so you can interact with, say, another family or with other family members, but it's only together and no other social interaction to try to decrease the spread. So it's really important to go for walks, get outside, make sure that you get a little bit of exercise. We know that exercise has a real strong preventative effect on developing mental health issues. The more steps you take, that increases the likelihood that you will not get depression and anxiety. You know, eating, sleeping. You know, sleep is such an important thing for one's mental health. Working on your relationship. I think it's more like co-parenting. I don't think anybody's talking too much about co-parenting during this pandemic time point, but how you and your partner are working together as a team to deal with the stresses around the household, this financial strain that Tiffany's talking about, the transitions that Darby's talking about. How are they managing those transitions and those strains so that they can work together as a team, and the division of labor and such. So that's a co-parenting model. Mark Feinberg has talked about it. You know, he's an American. He's got some really great models and several studies that have been published looking at that as a preventative effect. So these are the things that I think about when the pandemic is around mental health. And, you know, a lot of stresses that people say about spreading it to or getting it spread to themselves or to family members. So the social bubble thing, I think, is really important. So you still have that social environment that can be productive for your mental health, and you can still have some sort of interaction, but not in a grand, big scheme.
I just want to comment on one thing that Cindy Lee mentioned that I think Tiffany touched on too. So you said something about, if it's not your first child either. And that's something I feel like I've talked with a lot of parents about is, I've done this before. Like, why is it so hard for me right now? And they're not realizing or remembering that, you're in the middle of a pandemic. You don't have the village that you usually have around you. You may have the financial and economic pressures Tiffany mentioned, but they're sort of beating themselves up even more because this isn't my first rodeo. I should be able to do this. And so, I want to just kind of figure out ways that we can all help keep encouraging new parents to go easy on yourself and realize there are so many more layers to what you're dealing with right now, in addition to, having gone through this whole experience of having another child.
Yeah, I would second that. I mean, I think the transition to parenthood can already feel isolating. It can already feel challenging. It can already feel stressful. And in addition to the economic anxieties that Tiffany highlighted and the health-related anxieties that Cindy Lee talked about, some of the people that have responded to our survey have just said things like, I couldn't have a baby shower. I didn't get to meet new mom friends. I didn't get to go to prenatal yoga or, go to a breastfeeding class. Prenatal healthcare has been disrupted, not being able to see your OBGYN in person and build that relationship or have a doula, or, facing the prospect of delivering alone, not having a support person in the hospital with you. So, I think in addition to the great advice, that Cindy Lee gave, part of it is it's also important to acknowledge this is not normal, and it's also okay to grieve that this isn't going to be a normal transition to parenthood. We need connection, we need support, probably more during almost any other time in the lifespan when we're caring for a very helpless new infant. And so I like the ideas to sort of be creative and build those support networks in whatever way we can, whether it's bubbling or creating a pod or using online strategies as much as possible, getting outside. But I also think, there's room to just feel sad. And I think oftentimes new moms take a lot of that on themselves. Alyssa has led this Myths of Motherhood class for expectant parents that talks about this idea that it's supposed to be easy to have a new baby, and I'm supposed to fall in love with my baby right away and bond. And that's not necessarily true, and especially when you're having, that baby in the middle of a pandemic. If you are struggling, if you are lonely, part of that really is normative. And so I think moms can, instead of being so hard on themselves that you're sort of doing something wrong, I think sort of accepting that this really isn't an okay situation for any of us.
Mm-hmm. I also talk about gratitude, taking a focus on the positives of what's going on. There's a lot of focus on the negatives, especially when you listen to the news and the media, and infection rates are going up. And then of course you guys in the United States have, the whole election drama going on. So there's a lot of negativity right now. And so maybe it's good advice to suggest take a step back and to show gratitude for the things that you do have, and to focus on what is positive in your life, and to highlight that, and to have that conversation with your partner, your significant other, your family members. I think that can be very beneficial, because you tend to really dwell on the negative. But if you have a gratitude journal, that's been very popular, or you just write down every day something that you're really grateful for, that can help just with the mental cognitions of trying to stay a little bit positive during this challenging time.
Yeah, and I will say, some of our moms have reported silver linings, and I think there are some silver linings. For example, one of the toughest things about being a new parent is having to go back to work and put baby in childcare. And so being able to kind of extend the time at home can be really valuable for having a breastfeeding relationship, having more opportunities to bond. Although with the caveat that, not every new mom gets the luxury. Some are essential workers and really do need to kind of, be back on site in the workforce. But I think there has been something about the pandemic that has forced a lot of us to sort of like unplug, not unplug because we're on Zoom more than ever before, but kind of like hit the pause button on. So like we're also busy and there's, like our jobs and our routines can be so involved, and there is a bit of a break. And I do think that new parents often naturally kind of go into that cocoon in those first few months. And so in some ways, the pandemic has actually sort of fit that. I think it gets more complicated when you have extended family that are across the country that can't visit, and you can't have help. And if you have an older sibling who, you can't find childcare for, but there are some benefits to that ability to really nest and cocoon and sort of take a break, to whatever extent possible with the new baby.
Yeah, and that perfectly ties into, you already answered some of this question, but kind of the benefits of being pregnant during a pandemic, and are there any silver linings or benefits? And one thing Cindy Lee mentioned a bit earlier was one of the protective factors for mental health being partner support. And Darby, I know our study has found a little bit about partner support, and Tiffany, I don't know if you have any thoughts on this, but any thoughts on kind of how much time we're spending with our partners and what that could mean for pregnancy during this time?
Ooh, well, I guess I'll put on my personal hat now. I actually moved when my youngest was a month old to Madison. So I did not experience pregnancy during the pandemic, but I experienced a job change. I experienced a move across the country. So I understand those sort of stressors. I will say that, yes, it's helpful to have a partner to support you through this, but in the US, the social safety net is so patchy. It's so patchy, and there's just not the same level of social support. There's not the same level of access to mental health care, which I think definitely needs to be normalized at this time. So I would definitely recommend new moms and experienced moms go to therapy, because that's, at least for me, that has been a really important part of my mental health and wellness. And I think for me, I'm in a privileged enough position that I've been able to do teletherapy. And so that has been very positive for me. I haven't had to leave the house. I'm able to do that. So I would definitely say that hopefully that has been a positive thing, and particularly for disabled populations. I hope that there will be a continuance of these kinds of greater access to care in terms of telehealth for populations that normally weren't able to access that. And I think the second thing that is positive is, again, for people in the global South and contingent faculty who haven't been able to afford to go to conferences. Now, even though we're all tired of being on Zoom, that again has opened up a lot of opportunity for moms and for other faculty and other scholars that might not have been able to access those things. So I think that while Zoom is tiring, I think that getting to meet all of you and getting to have experiences like this is one of the positive things that has come out of the pandemic, and I hope it continues.
Yeah, I hugely agree with that. And I think it's really interesting to think about like what's going to stay with us after this situation has resolved and we've started to get back to normal. And I think this idea of having increased access to therapy or to healthcare, right, that we've sort of normalized remote healthcare visits, I think that'll actually be really valuable to pregnant women, who want to get breastfeeding support. Or I have a friend and colleague who works on family visiting, doing home visits with new families, and she's been trying to get research interest in doing remote home visiting for a long time, which is really a game changer for rural families or families that have various barriers to being able to do home visiting. And so I hope some of these things endure. And then I think the other piece is we've normalized working remotely, working off site. And a lot of working moms for a long time have wanted kind of more flexible work-life arrangements where, you don't have to be in the office to do a face-to-face meeting if most of your work can be done from home. And so I hope that some of that actually builds in more family-friendly workplaces, which could be something that relieves stress for parents in the future.
So I will say that I love the pandemic as to what it's done to validate my program of research. I've been doing I do clinical trials, and I've been doing telephone-based interventions for new mothers my whole career. It started as my PhD dissertation, over 20 years ago, where we did telephone-based support for new moms, and we linked them up with an experienced mom in the community. And we found that these new moms who had telephone support, never saw each other. They just matched them up based on where they live. That these mothers who have received this telephone-based support from an experienced mom, successfully breastfed, they were 3 times more likely to continue to breastfeed and to do so exclusively. I took that telephone-based peer support model to mental health, and we found in another large clinical trial with over 700 women who were depressed or feeling a little bit depressed after the birth of the baby within the first 2 weeks. So it was very, very early. And what we did is we matched these mothers up with another mother in their community who felt that they experienced postpartum depression, had recovered, and participated in a training session that I had. And then, so teaching them how to provide support over the phone and such, not about postpartum depression, but how to provide support and to be an effective listener and such. And the mothers who received the telephone-based support, we cut the rate of postpartum depression by 50% at 12 weeks postpartum. Very simple, cost-effective types of intervention where we create support networks. And now, taking it into a treatment model, we said, well, there's not a lot of perinatal psychiatrists around to help mothers with the treatment. We talk about therapy, and maybe there's a lot more therapists in the United States, but here in Canada, we have more universal health care, and there's not a lot of access to therapists unless you want to pay for it out of your own pocket. And so there's been some challenges, and perinatal psychiatrists tend to be in urban settings and not in rural, remote settings. And so what we did is we said, well, what healthcare professionals are in rural, remote settings? Where can you always find, diverse healthcare professionals? We said, well, nurses are everywhere. So what we did is we got 2 psychiatrists, and we had them train up 7 nurses who were primarily public health nurses. So these are just maternity nurses. Train them up to provide interpersonal psychotherapy completely over the telephone. And we recruited clinically depressed mothers, like clinically SCID-positive depressed mothers across Canada, all the way from Nova Scotia to northern British Columbia. And these 7 nurses in Toronto provided telephone-based psychotherapy to these mothers. And we had an incredible treatment response and a very large magnitude of effect. And huge compliance. Women loved it. And why did they love it? Because they didn't have to leave their home. The nurse provided it when they wanted it provided. So if they wanted it Wednesday morning, they provided the weekly sessions Wednesday morning. If they wanted it Saturday afternoon, they got it Saturday afternoon. If they wanted it Sunday night, they got it Sunday night. And so, we talk about these types of interventions. They've been around, but there's been no real solid push to move them forward because there haven't been billing codes. People can't get money compensated for their time to do these telephone-based types of interventions. And thanks to the COVID, now we have billing codes for this because the psychiatrists want to actually get paid. Other people want to get paid to deliver it. And so now we have family physicians, pediatricians, everybody providing the provision of care through technology, whether it's the telephone, whether it's Zoom, whether it's whatever other type of platform you want to talk to. So that, I think, is a huge push. And do you think it's going to go back? I actually don't. I think we've had this hierarchy with face-to-face, but the younger generation who are having children these days, they're very tech savvy, and they actually feel comfortable having these types of virtual conversations and having access to virtual care. So I think that's one real positive of it. And it validates stuff that we've been doing for years and talking about it, and nobody's been uptaking it. It takes a long time, to uptake these types of interventions.
I hope it's one of the things that sticks around, because when I think back to having my son 5 years ago, and the breastfeeding problems that I was having. And I mean, I was lucky that I was in a very privileged position enough to be able to have a lactation consultant come to my house, because I was like, I am not going out right now. I mean, I can barely walk. I'm not going into the hospital and taking this, 5-day-old or 6-day-old baby who wanted to eat around the clock. Like, he was born almost 10 pounds and he just ate for like a month straight. So, but I was able to do that. And I was lucky that I had the resources to do that. But I would, there's no reason really why I couldn't have shown, a FaceTime call of like what was happening and what he was doing. And I think that hopefully that is something that continues as we hopefully return to normal at some point.
Definitely.
Yeah, sorry, I just had to jump in with that.
Yeah.
But I think everybody's got those types of experiences, right? Where it's been a challenge to go and access healthcare, and wouldn't it have been and you don't need to have someone coming to your house. And, some people feel uncomfortable about individuals coming into their home and being judgmental. And of course, you have to clean yourself up and all of these other different things, where this technology might, really minimize barriers to seeking care and treatment.
Definitely.
Yeah.
Definitely.
I want to make sure we talk a little bit more about postpartum depression and anxiety. So if you had the opportunity, what's one thing that you would tell new parents? Tiffany, can we start with you on this one?
Oh man. Okay. What would I tell new parents? I would say there are a lot of ways to do this right. That's what there are a whole lot of ways to do this right. And you're probably doing just fine, and trust yourself. I mean, of course there, I read all these parenting books. I read Bringing Up Bebe. I read, the prenatal yoga, but at the end of the day, I figured it out. And I think that for me, the most successful thing that I've done at parenting was understanding that I'm raising an autonomous human being, like that I don't own my child, that they both are their own person. And that has put me in very good stead. Very, very independent. He will tell me if he's upset with me or he has a problem with me, but I feel like that's what we've done really well. Raising a free and wonderful Black boy has been a joy for me. So you're doing it right. Please trust yourself and remember that you're raising a human being with their own wants, their own wishes, and their own dreams.
I love that. I just wanted to add, it's kind of onto what Lindsay said too earlier about not knowing like that it could be postpartum anxiety, right? We always hear about postpartum depression. And I think the thing that I would say is just that it can also look even different than that. For me, it was postpartum rage. Like, I had a lot of anger, and I didn't know that was a way that anxiety or depression can manifest. I had always sort of thought about that as, the classic depressive symptoms. So it was hard for me to tell that anger and rage, and for me, a lot of it was directed at my partner, right? He couldn't do anything right. That a lot of people feel that's just new mother irritability. But know that is also sometimes what postpartum either depression or anxiety or a combination of both can look like. And I just don't think people talk about that very much either.
I have my 8-year-old coming into the room to join the conversation. But if I were asked to speak to a new parent, the first thing I would say is talk to Tiffany. And then after that, I would say, there he goes, getting his video game supplies, of course. And then I think I would, after they talk to Tiffany and get that wisdom, I would say like 2 other things. Like, one, this is a transformative time, as we've talked about. There's a lot going on. There are a lot of layers of changes. We have these narratives in our culture about sort of like getting your body back after baby, getting back to the office, getting your old self back. I think we celebrate that, the mom that can sort of bounce back. And I would say, like, accept that you're a different person and that it takes time to transition. And in the same way that you would be kind and patient with a newborn baby, you can be kind and patient with yourself as a newborn parent. Don't expect that you are necessarily going to bounce back and sort of be your baseline self immediately. And then I'd also say, like, we're not really designed to do this alone. And our culture is sort of uniquely lonely and atomized and isolated. And, we've talked already about this sort of, it takes a community, it takes a village. Like, the sort of model of one parent with one baby isn't really the way that we're supposed to do this thing. And so, you know, find those communities as much as you can, even during the pandemic, if it requires getting really creative, because we really, as humans, kind of like, we need that support around us to do this. This isn't a job that we're supposed to do solo.
Yeah.
I think that's good advice. Well, if I had to give advice, I would say healthy babies start with healthy parents. And you can't take care of that baby the way you want to take care of that baby unless you're taking care of yourself as well. Your needs also have to be met. And how many parents do you know that they're feeding their baby organic carrots and organic this and that, and they're eating like terrible food themselves because they're not taking care of themselves? And so I think self-care is huge. I think time for self. I remember reviewing a clinical trial that was conducted in Australia, and one of the biggest predictors of postpartum depression in this sample, in this clinical trial, was time for self. And women who had time for self every day, just a little time for yourself, where you watched your own show, where you had a shower and washed your hair, where you did something for yourself that was sort of enjoyable. And it's not about going and getting groceries, but without children. It's about doing something that's pleasurable for you. So I think that this is really important. And so think about healthy behavior. So, how you're eating, making sure you're getting physical activity, making sure you're getting sleep, monitoring your screen time and not overdoing those types of sedentary types of behaviors. I think that that's really important. And then be very cognizant of your relationship. We know that 1 in 10 men also develop depression. And if the father develops depression, that's a real big risk factor for the mother to develop depression. And we know that we think that about 23% of families where both mom and dad have some sort of depression or anxiety in them. So mental health is a real big factor, and that you have to be supportive of each other. And even though that partner might not do things the way that you would like that partner to do, for example, my husband would do things with our child and would never do it the way that I would tell him to do it. I would teach him to do it. I would, encourage him over and over and over to do it. He would always do it his own way. Now, I used to be very frustrated about that. And then I was thinking, he's given the baby a different stimulating experience. And so if you flip it to the other side, okay, sure, he's not doing it the way you want it to be done, but he is doing it. That's, I guess, positive. And he's stimulating the baby in a different way. And so make sure you're supportive of each other, that you co-parent together, that you make sure that you have checks and balances for your mental health and well-being. And that understanding that perinatal mental health is a family affair. It's not a woman's mental health issue. We like to frame it as a woman's mental health issue, and we stigmatize it because, it's a woman's mental health issue. She had a baby, and this is, a response. But what it is, it's a response to a real significant transition, and it's a response that both mom and dad can have, the whole family can have, and we need to conceptualize it as family-centered care around perinatal mental health. So taking care of that family unit, and then they can provide a good environment for that child.
I really want to piggyback on that point, because that's one thing we've found in our lab, and we have a paper that we just submitted on this, is that when dads take paid paternity leave, which is not universal in the US, moms actually have better trajectories of stress and depressive symptoms. So, like what dad is doing can really have an impact on mother's well-being, in partnered families, which of course is not the universal family configuration, but when that's the case. And also, Cindy Lee said, like, we often think about, this is a women's mental health issue, but we know that, and this is something we've looked at in our lab also, like, we're doing neuroimaging to look at men's brains over the transition to parenthood, and we have some preliminary evidence showing that the male brain does reorganize when men become parents, just as there's some evidence that the female brain does as well. And we know that hormones can fluctuate for new dads as well as for new moms. And there are lots of animal models suggesting that, testosterone and other hormones change in new dads. So there's a lot going on biologically for men as well. And we know that, mental health symptoms, like Cindy Lee said, are correlated within couples. I've done some work looking at sleep within couples. So we know that, when there's sleep disturbance, fathers can experience fallout from their partner's sleep disturbance and vice versa. So, there's a lot, like thinking about it as a family system, as opposed to just thinking like there's something that might be wrong with the mom, I think is a really important lens on all of this.
Mm-hmm. Absolutely.
Thank you all for those all of that great information. So we're going to shift to some question and answers we've received both prior to the webinar and live. So I'm going to invite you to post in the Q&A. Victoria has posted a link there that you can send us some Q&A questions live here. And I also want to remind you to please fill out the 1-minute feedback survey before you go. Oh, I'm sorry, that's the link in the chat box. got confused there. So we got one question prior to starting the webinar that was sent in early. So October is Pregnancy and Infant Loss Awareness Month. And I know there are also many people, the road to pregnancy itself, it can be challenging. So many people struggle with infertility. They're at various stages of the adoption process. How has COVID-19 impacted those families, both in terms of infant loss and infertility and adoption?
Well, I mean, let me think. I don't really do a lot of work around infertility, pregnancy loss, but I think, I think validating a woman's experience. I mean, I can't say I've had a lot of experience around this in a professional stance, but I've had a pregnancy loss myself, and I remember very much my obstetrician saying, I says, I remember going for an ultrasound, and the person said, the baby's struggling, and I was miscarrying, and said the baby's struggling, and that made me feel very upset because I felt like the baby was having a really hard time. And then I remember the obstetrician telling me, he said to me that it's just cells, it's not a baby. And I think just really minimizing, or the language that we say when we talk to these individuals about their experience, and I think we need to be sensitive to it. And I don't know what's the right and wrong way to communicate around this, but I know that sensitivity, and I know that it was a very trying time for me. I felt very upset. My husband, on the other hand, it really didn't impact him, so I was really surprised that he wasn't impacted, but then I felt so upset about it, and I had this need to talk about it, and he didn't need to talk about it. So, obviously your partner is a really good source of support, but not necessarily always the best support for certain types of stressors that you may have. So that's just, a little bit of personal information about what happened to me and how I handled it. And I had to go talk to someone about that. And so I think that that's probably the advice to say is talk to an expert, make sure that you don't keep those feelings inside. And then, of course, if you're going on to have another pregnancy, I mean, there's going to be a lot of stressors thinking, well, am I going to miscarry again? Am I going to experience this again? So making sure that you have a great support system around you and that you're aware that you are vulnerable to feeling high levels of anxiety, and that's okay. It's normal. It's natural. You've experienced something. And hopefully that you'll be able to have individuals to talk to make you feel less calm or more calm about the situation. So, I mean, that's not a very professional response, and I understand that, but there's some comments about that.
Thank you for that. Thank you for sharing your personal experience. Tiffany, I was wondering if you had any thoughts on this, given kind of your hand in public health and the disproportionate impact of infant loss on Black women. Do you have any thoughts on this?
Well, I think so. So two things. One is that from my reading, I have read that some people have had challenges with having their fertility treatments suspended because they were considered an elective procedure. And of course, some people would argue, of course, this is not elective, this is something vital. But there have apparently been some mental health issues that have emerged from people getting their treatments canceled. And if you are set on becoming a parent and you have this happen to you, I can only imagine how traumatic that must be. The other challenge that I'm seeing in my other life, I am a humanist celebrant, and I see all the people, fellow celebrants, talking about funerals, and a lot of people can't have funerals with their families. They can't be with, fly across the country or even go close by to put their loved one to rest. And I think that has to be probably very traumatic. I haven't done any funerals here in Wisconsin, but again, I'm definitely seeing from fellow celebrants these issues with having funerals and people not being able to connect with people during a death. I think that has to be really hard.
Yeah, the pandemic takes what's already really challenging and complicated and just kind of adds these extra layers of complexity. One thing that one of our colleagues within the lab has been looking at is also like decisions about whether to try to conceive. And, the idea that like it's not always easy to conceive a baby and sometimes requires additional assistance and sort of how to time that and how to optimize that. And that becomes really challenging during, quarantine if you're not wanting to be visiting with medical practitioners, or if you're just worried about the uncertainty, the fear of getting sick, or just the state of the world. And so, a lot of women, a lot of couples are postponing decisions about conceiving. And so it just sort of puts this huge, important part of your life on hold, which I think is just another big source of challenge.
Well, I was going to say something.
Yeah,
really quick.
go ahead.
Sorry. I was going to say
you
that
go.
we have a survey in Wisconsin called UW called the Survey of the Health of Wisconsin, and the plan was to go back into the field, but obviously that didn't happen in March, and so they've been doing some pretty extensive COVID supplements, and so they agreed to add some of my questions in the field, looking at contraception use to see if people's contraception use had changed during the pandemic. So stay tuned. And of course, there are also a lot of other questions about family life and stressors related to COVID. But I'm really, I don't want to say looking forward to, but I'm really, really curious to see how that has changed as a result of COVID, like fertility patterns and potentially contraception use.
I would totally agree with you on that one. We're just starting, I'm just leading a $17 million trial where we're going to start an intervention preconceptionally with families. And we're targeting child obesity at age 5. And so it's a 4-phase type of intervention where we start preconception, then we move into pregnancy, and then into infancy and in early childhood. And it's telephone-based. We're hiring public health nurses to deliver this intervention to improve health behaviors and a whole bunch of variety of things, screen for mental health, all this different stuff, to get these families to be in a really healthy state before they have a baby. And we're concerned about recruiting. We're recruiting in Canada, and that's probably the same as in the United States. 50% of pregnancies are unplanned, so there's no real preconception care there. And then the other 50%, we don't know exactly when women are going to have their first child. And so we have looked at that. I think the best way to provide preconception care is after the birth of the first baby. And then often in Canada, women have on average 2 children if they have a child. And so they tend to have, and if you look at the child spacing data, they tend to have children between 2 and 3 years after the first birth of their first child. And so what we find is that's a prime opportunity to provide preconception care. And so we're moving towards a preconception care model, but we need to recruit over 5,000 pregnancy planning families in 2 years because we're following these families to the child age 5. So you probably have 2, right? If you have 2, you tend to stop because the chaos is just beyond believable, right? Like, when you have 1, it's 2 parents, 1 child, right? Everyone can have a break, there's tag teaming and everything else. When you have 2, it gets a little chaotic. But nonetheless, we're really concerned about our recruitment because some of the data we're seeing as well is that women are deciding not to have children during this COVID, or trying to have children during this COVID time point, because, you know, they actually don't really, they're not sure about the virtual care during pregnancy. They actually, I think they feel in the third trimester it's nice to go see someone every week for reassurance and such. And, you know, it's just a very traditional model that people are very dependent upon. So I think that they're concerned about that. They're concerned about, you know, just the whole provision of being pregnant during, you know, who knows how long this is going to continue to last. So that might impact us as well. So we're really concerned about that. Though some people say you're now spending a lot of time at home and your partner is around more, and maybe people are bonding more, and you know, maybe there's going to be more of those percent unplanned pregnancies. You never know where this is going to go, actually.
Yeah. Well, I can totally, it kind of, and I did say I wanted to kind of share a little bit about my personal experience. I know we only have a few minutes left, but, and it links with that, because a couple of years ago when I was living in Miami, Zika transmission had just been announced locally in Miami. And of course, if you remember Zika, right, this new virus that was having devastating effects on fetal development. And it was a really scary time. And we decided to try to conceive anyway, because, you know, I was in my late 30s, and, you know, we thought it would take a long time. It didn't. And, you know, I was called by my OB when I was 7 weeks pregnant to say that my Zika test had come back positive. And it was actually almost 4 years ago to the day. So hopefully I don't get too emotional talking about it, but it was like the most devastating phone call. And I couldn't believe it, because we had been taking all of these precautions and we had been so careful, and it was just so shocking. And 7 weeks went by before I finally got the test back from the CDC, which was that my test was a false positive. But you know, now I'm 13 weeks pregnant, and it was a horrible couple of months of waiting, but nobody could tell me anything. You know, it was all like, this is such a new virus, we don't know. I was going to an advanced maternal fetal specialist, you know, just the resounding answer over and over again was, you know, we just don't know. Like, we don't know. And it was just it was a really traumatic time. And then even after that ended and I found out the test was a false positive, it was still 7 months of, basically, we spent a lot of time indoors. We, you know, I wore long sleeves and long pants. This is in Miami. It was like hot all the time. And just we're trying, but I look back on that time now, and I still, it's years later, I grieve that pregnancy in a sense. Like, it was not what I expected. It was very anxiety provoking. Even going outside had just these levels of anxiety, and there's part of me that's still a little bit like bitter about it. You know, I knew that was my last baby, you know, and it's like, I wish that hadn't, you know, and had I been living anywhere else in the United States, I would not been dealing with it, because it was really just South Florida. But I'm just rambling now, but I guess my point is, I don't know what it's like to be pregnant during COVID-19. I do know what it's like to be pregnant, like when there's this, you know, novel virus, and it's highly stressful. And I think that my hypervigilance and anxiety the whole pregnancy really came to a crash, like when I finally had my daughter, and you know, things did not go well the first couple of months. And you know, everything's okay now, but it was stressful. I don't know. I've turned this into like a personal therapy session now. Sorry.
No,
I think that these stories are important because they validate first of all, your experience. And I think other women have had, like, there's obviously thousands and thousands of women who have also had this experience. And, you know, remember in March when, you know, we first found out that this is, you know, sort of a pandemic, and, you know, look at what was happening in New York City. I think a lot of people were sort of, you know, what happened in Italy. I think a lot of people were very anxious and stressed about this, and, you know, many people experienced what you are currently experiencing, because there was no one knew what was going on with this COVID, right? Like, it was the unknown. And you know, and everybody's in lockdown. Like, it was a ghost town up here in Toronto. Like, you could get from one end of the city to the other in, like, I don't know, half an hour. And that's like impossible.
So I think, I just
home.
wanted to, let people know that, to be aware that this could that you could experience this, that it could be something that, that it's okay to grieve what you thought it would be like and what it ends up being like, and still be very grateful for, the child that you have and such. So
I think related to that, Lindsay, I know we only probably have time for like one more question, but just related to that, I think it is so important for us to also honor and name the experiences of all of those families who are in various stages of the adoption process right now. We've heard from a lot of parents about how that has been halted, or, moving forward with adopting a child who is a foster child. Home visits came to a halt. And so the heartbreak for so many families in a process that already has a lot of barriers, that things really came to an abrupt halt. So that is a really important part of, I think, this conversation for us to validate too.
Yeah. There's a lot of sense of loss, right? Like a loss of your normal pregnancy. This is the loss of a trajectory of, adopting children. There's a lot of sort of loss of, you thought you'd be having a child next year, and now you're uncertain. So, and it's okay to acknowledge that. And it's, this is where, having conversations like this is really important.
Yeah.
Normalize.
I see that a lot coming up in the online mom groups of people who are wondering, should I try to conceive or should I wait? And it's just very, very complicated for people. So I know we're getting towards the end. I mean, we should probably wrap up.
So just
soon,
one question here that came through on the chat box. So what advice would you give to a pregnant woman who's nervous about contracting COVID? Or on the flip side too, worried about being isolated during this time and the effects that could have on her newborn's psychological health. Any thoughts on that, kind of the two sides of the coin?
Yeah, I saw the questioner was also saying, how do I handle like when my family members aren't following the science, aren't wearing masks or taking precautions. I think that's really tough, right? You're really sort of caught between a rock and a hard place, because you're wanting to stay as safe as possible, but you're also really, needing to lean on that family. And I think, the best thing you can do is just be really clear and set some very, bright line boundaries. Like, I'm sorry, here's what my OB told me, and we won't be able to go to your house for a barbecue unless you're willing to do X, Y, and Z. But it's a really tough situation because we have so many sort of different levels of people taking this seriously. Unfortunately, in the US, it's become this politicized partisan thing, which is very frustrating. And so, like within a single family, you might have all kinds of different perspectives on how careful to be about this. And I think you just have to go with what your doctor's best advice is.
Great.
Yeah, I saw Tiffany responded to that one as well.
Yeah, I mean, the tough thing is that, here in the US, and I'm sure it's the same in Canada, you have essential workers where people have to go to work, and then they have elderly people in the household. It's all just really challenging. But if it's a situation where it's voluntary, you need to just stick to your guns, because you will regret far more if something bad happens versus having to have what you feel is an unpleasant conversation. They shouldn't be putting you in this position, but you will unfortunately probably have to advocate for yourself. And I also gave you a reference as well to Dear Pandemic. I'm a big fan, and now I'm a fan of pandemic parenting. But Dear Pandemic is a group of colleagues that have very up-to-date science communication on COVID-19, and it's nonpartisan. So it might be a useful way for you to have the information to give to your family.
Great. Thank you for that. So I will turn it over to Amanda. We're just a little over time. I'll let you wrap up. Thank you.
Thank you. Thanks so much, Alyssa. So we want to thank everybody for attending. Please do let us know what you thought. The feedback link is in the chat, and give us your thoughts and suggestions for future topics, questions that you want us to tackle. I want to give a huge thank you to our wonderful panelists, Dr. Cindy Lee Dennis, Dr. Tiffany Green, and Dr. Darby Saxbe for joining us tonight. We really appreciate you taking the time to have this important conversation. I want to thank Alyssa, who did a fantastic job moderating, as well as Victoria, working behind the scenes, our whole team at Pandemic Parenting, Stephanie, Megan, who provided us with lots of research assistance for this topic tonight. If you learned anything tonight or find these resources helpful, we encourage you to consider making a contribution or having your organization reach out to partner with us. Consider sponsoring a webinar. Lindsay and I donate all of our time to Pandemic Parenting, but we need to support this fantastic team of students and early career professionals who support us. So we thank you for your support there. You'll find links to our previous webinars and resources at pandemic-parent.org/resources, which Victoria will put in the chat. You can also follow any of our social media accounts that you can find at our Pandemic Parenting website as well. And finally, we invite you to join us for our next webinar on October 29th, which is called Anti-Racist Pandemic Parenting. We have some fantastic guest experts who will be joining us for that really important conversation. Again, that's Thursday, October 29th. You can register at the link that Victoria will put in the chat, and we'll be sending out more information about that as well. So thanks again, everybody, for being with us. Please keep taking good care of yourselves, and we will see you again soon.